95% of the patients that they were working with were smokers. Now, what that says is that health problem was created by cigarette smoking. Let me ask you this question. Why, as a nation, do we tolerate selling and consumption of a compound like cigarette tobacco when we know it destroys public health?
I think there's probably two sides to that equation. One is there enough outrage, public will, political will? I talked about a healthy democracy being a key to a community or a state or a nation's ability to change itself and move itself forward. So that's one side of the equation. And of course the other is the powerful interests that exist that are profiteers that are looking for, they're making profit from this.
People who make and people who sell cigarettes. And of course the cigarette smokers, they're actually addicted to a drug, and that compound, those tobacco products, are spiked with chemicals that increase the addictive properties of that particular tobacco compound.
The best thing the FDA could do for us from a public policy standpoint is get rid of the addictive chemicals that are in cigarettes.
And yet Americans want the choice to smoke, and that's an issue too. But you have to ask if the cost is destruction of America's health, then should we allow people to smoke? We don't do it with heroin.
You're balancing a powerful thing here, and again, this is where that democracy piece comes in, Dave. You're talking about American traditions for individualism, personal rights, and the greater good of the community.
But for your program to work that you espouse, which is to improve America's health, I mean, isn't it kind of based on the idea that we need to do those things which on an individual basis improve our health, and thus, in other words, a nation's health is one human being, one set of personal life choices at a time, which means don't smoke, exercise a little bit more, and eat right to improve your general health. But what do we do if people won't move forward in that direction?
Let me look at it, though, and offer another thought on that. Let's use physical activity, okay? And it's very clear, the evidence is very strong from the time you're a little child. In fact, moms being pregnant, being physically active in your youth, in your adult years, and in your older years, there are all benefits to that, okay? But it's not always a case of the person not knowing. If 9 out of 10 people, if you ask them, should you be physically active? Dave, should you be physically active? You're going to get an affirmation. But there are other things happening in our society, Dave. In the last 50 years, okay, let me go to public policy. Some of our school systems have reduced physical education.
And at the same time, they're increasing the very foods that we know affect health, like sugared pops, French fries, and hamburgers, which lead to obesity and thus diabetes. So we're kind of poisoning our kids and keeping them from exercising. Not a good move for a nation that wants good health.
And we've experienced sprawl, where we've spread our communities out, okay, and reduced people walking, the walkability of some of the communities in the outlying areas.
You have to drive your car everywhere you go.
Yeah, we have a powerful initiative, a group here called Partners for Living for a More Livable Western New York, whose mission is to help communities understand how we can build more livable, bicycle, pedestrian-friendly communities.
Who is your organization talking with? I mean, do you go to the mayor and talk about your ideas? Do you go in front of the medical leaders and talk to them about your ideas? Who do you talk with?
Everybody. And I say this in a positive way. We'll talk to public officials, we'll talk to other nonprofits, partner with them, we'll talk to businesses, and we'll talk with citizen groups like block clubs. They all have to be at the table. If you're going to create change in your community, Dave, if you don't have a particular sector, let's say if the government isn't at the table, then it's that much harder to get to the changes that you want. So we really reach out to all of those
Have you been able to affect change?
Yes, and there's a couple of places that we've been able to do that. For example, I was deeply involved, as I mentioned with you, from 90 to 2000. I was the chair of the Tobacco Coalition. Where we're working today is with physical activity, and we're beginning to get activities and things happening that are improving the environments in the communities that we work in.
Very good. We'll be right back with more critical information on America's future relating to health. And I guess that's all of us, you and me, in just a moment. Hi, Dave Kettlewell back with Phil Haberstro of the Wellness Institute. And we're going to start off this segment with a story I'm going to share with you and see what you think. I got a phone call from an individual in the public, and they said, could you listen to my personal story with my health? And I said, yeah, happy to. What happened? Well, when I was young, I worked with benzene in a rubber factory because we cleaned our hands with benzene, and that made me contract leukemia 20 years later, which was a very rare form of leukemia that almost everybody got when they worked with benzene, and about 20% survival rate. Liquidated his personal assets and prepared to die. Had insurance from a large health insurer. Was sitting in the hospital after bone marrow transplant. He was surviving about 75 to 80 pounds. And they said, are you working full time? No, I've been going through bone marrow transplant treatment and I have leukemia. Are you making $800 a month? No, I haven't been working for 5 months. I'm in the hospital. Well, you no longer qualify to receive coverage from our organization, so we're cutting you off. And they did. And he said to me, do you think it's right that an insurance company would issue a policy for coverage which ipso facto results in your being dropped if you really get sick? And you know what I did? I went to a gentleman named Marty Hauser, who's the president of SummaCare, which is a large managed care organization in our community, and a man of conscience who I trust and the community trusts. And I said, Marty, what's your thought? He goes, I don't like that story. He goes, we need change. We need legislative change in America where insurance companies can't do that sort of thing, or insurers, including his. He said, it isn't good. But those rules have to be applied across the board. I'll give you another one. Suppose that your dad had a heart attack. You'll never get insurance again at a reasonable cost for the coverage of your heart because insurance companies will preclude any existing illness. That's another thing we need to change. Now, Dr. Bill Keck, who's a national expert and writes textbooks on public health policy, phrased this whole thing very clearly for me. He said, Dave, here's the issue. He said, there is a lot of medicine and medical care in America that is in the hands of the free enterprise, for-profit organizations. And he said, that's good, because that's America. They make their decisions based on increasing shareholder value, which means more profit. But he said, there are times when the decisions made by the for-profits will be at odds with what's good public health policy. As an example, I don't want to provide you the money you need for your treatment because our company makes more money as an insurer if we don't, but for you and for the public health, that isn't such a good thing. And so the question then becomes, how do you find solutions within the free enterprise system without going to a single payer system? And I think that there is a moral imperative here because it is implicit, an implicit understanding between the for-profits in the United States and the American public, which is that you will work for the greater good. You will support the public health policy. If not, I'm not sure they have any moral ground on which to exist. The medicine requires that we move forward as a nation for the good of others. But Marty's suggestion was to put together a consortium of 5 to 20 heads of provider-owned managed care insurers, get them together and decide how to make things better and to push for those solutions. Not from some newscaster who's tearing an industry apart or a Michael Moore-esque person who's a speaker talking about all the wrongdoing, but let those who know most about it, because you know the people that work in the managed care companies know what the problems are. They know where people are getting hurt. But their point is, we can't do it in a way that serves the greater good if everybody else doesn't that's in our business, because we'll go broke. Right. What do you see as some of the issues that are here in America where we have the free enterprise system on one side operating, and in many cases doing a lot of wonderful things with a lot of wonderful people, and on the other, people standing on the other side saying, you know, some of this is not in the interest of public health policy. For more Medical Matters television shows, go online to medicalmatters.tv.